Today we'll be looking at the anatomy and physiology of a long bone. As we go through the structures and functions, you should be filling in your diagram. This is basically known as the macroscopic structure of the bone because we are looking at the entire bone together. Later on, we will look at the microscopic structure of the bone separately. You should be having your diagram out, and you should be referring to your diagram as we go through the parts. You should also be filling in the diagram and then making notes separately of the functions. This diagram does correspond to a typical long bone. Remember, this is one of the types of bones. It's found in the arms and the legs, bones such as the humerus and the femur, and also the phalanges and metacarpals and metatarsals in the hands and feet. The first structure we're going to look at is the diaphysis. This is structure number 8 on your diagram, and it's found right there. The diaphysis is the middle section of the bone known as the bone shaft. At either end of the bones, we have a structure called the epiphysis. The diaphysis is made of a specific type of bone called compact bone, and that should be shown as structure number 2 on your diagram. The epiphysis is found at either ends of the bone. In the diagram, we have both a proximal epiphysis and a distal epiphysis. This corresponds to number 7 and 9 on your diagram. Keep in mind that proximal is referring to closeness of the point of attachment. This is the femur, so proximal would be referring to location relative to the hip. Distal epiphysis is the far end of the bone. The epiphysis contains a type of bone known as spongy bone, which would be number 1 on your diagram. Here's a close-up picture of the spongy bone. Spongy bone has a lot of open spaces, and in the adult that would be filled with red bone marrow. When you do a bone marrow test or a bone marrow transplant, you often remove bone marrow from that section of the femur. Another structure shown in this picture is the articular cartilage. It's number 4 on your diagram, and you can see it up here at the top. It's actually located at both the proximal epiphysis and the distal epiphysis. This is cartilage that coats the ends of the bone, and it helps to reduce shock and friction at the joint. Looking at further structures on the long bone, we see a structure called the periostome. The periostome is right there. It is the outer covering on the bone. It's made of dense connective tissue, and it covers and protects the bone. This would be number 5 on your diagram. The periostome is going to contain bone that grows cells that add thickness to the bone. So as your bone grows thicker, the cells that create that thickness would be found in the periostome. The periostome also protects bone, and it assists in fracture repair. So the periostome has several functions in the growth and development of the bone. The periostome is also the outer covering of the bone, and it does provide the attachment point for any tendons and ligaments that would be attached to this bone. Remember that tendons attach muscle to bone and ligaments attach bone to bone. The next structure on our diagram, number 3, is the medullary cavity, and it's shown right there. Medullary, referring to middle, is a hollow cavity in the middle of the long bone. In adults, the medullary cavity is going to be filled with yellow bone marrow, and you can see that in the picture. The final structure here is the endostome. It's not shown in our picture to the side, but it is on your diagram number 6. And the endostome is the lining of the medullary cavity. Endo would be referring to inner, so it's an inner lining, where periostome is outer, an outer lining covering the entire bone.